इसको
स्पाइनल कितने गेज की, कितने गेज की?
हाँ,
स्पाइनल
इसमें थोड़ा सा जेल वगैरह कुछ डाल दूँ?
उसमें स्पाइनल है। अच्छा माफ कर दो।
अनफ्रीज 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 अनफ्रीज।
डोंट एक्सचेंज गेज नेडल।
यार ये तो कुछ दिख ही नहीं रहा है।
नहीं सर, प्रोब चेंज नहीं किया है ना।
ये वाले प्रोब को सिलेक्ट करो, प्रोब को सिलेक्ट करो।
हाँ, आ गए सर, फिर से गया। इट गॉट चेंज्ड। और एक, हाँ, डेप्थ डेप्थ कम कीजिए। पूरी बैटरी ले लो। बैटरी, यस सर, डेप्थ कम कीजिए। हाँ, कम।
हाँ ये आ गया।
एक्सप्लेनेशन नाम है।
ये आ गए, दोनों प्रोब्स आ गए। इसकी अब डेप्थ कम कर दो भैया। हाँ हाँ हाँ, बस थैंक यू थैंक यू थैंक यू। See, now you can see both the condyles. I am talking about the femoral condyles. We are trying to negotiate the ACL proximal part. So this is the
Sir, we cannot
lateral
see
femoral
the
condyle.
picture big, so can somebody
This is the
make the picture
medial
big?
femoral condyle.
No,
and
the PIP को बड़ा कर दो.
now the trick is
Reverse the PIP.
we'll move it contralaterally 20
Yes, thank you.
degrees so as to see the हाँ ये नीचे आ गया है।
ये
पोस्टीरियर
वैसे.
एंटीरियर क्रूशिएट का पार्ट ये नीचे जो दिख रहा है बिल्कुल सबसे नीचे।
Sir, can you explain the structure so that?
Okay, bring it closer to me. I'll do it. Start from once again. First, I'll show you both the condyles. This is the medial femoral condyle. That is the lateral femoral condyle. Presently, you are not seeing the anterior cruciate. Now, you just see that we know that it lodges in the posterior in the lateral condyle posterior part. So this is the lateral condyle where I am moving it. Now I am moving my probe slightly counterclockwise. On moving it counterclockwise, I can see deep down the ACL, the attachment on the medial condyle, on the lateral condyle. This is the ACL, just top of it, yeah. This is the top of it, yeah. This is the ACL. You can see a small structure like this. This is the ACL. So our needle will go and it will hit at the ACL. Can I have something to sit down और कोई बैठने का कुछ है? हाँ चलेगा, चेयर चलेगा।
वो डालो।
और अंदर कर देना। बस बढ़िया, अब मजा आया। नहीं नहीं perfect perfect perfect. Now again we will be going out of plane because in plane there is no space for in plane. बस 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 बाबूजी बस बस. See, we are just about to enter. Can you see the tip of the needle? We are on the superficial part of the anterior cruciate. Now we are inside the ACL. I'll try to focus the needle once again. This is the lateral femoral condyle, and this is our needle. Can you see now the tip of the needle? Or upar. Yeah. This is the tip of this is the needle. It is now in the on the proximal part of it. So they know just there are PRP. From MRI also you can choose whether you have to do both anterior and posterior. If it is a distal part, then you only do the anterior part. If it is the proximal part, then you do, if it is a throughout, then you have to do both the sides. But just for the sake of demonstration, we did both the sides. Our procedure is done. Thank you. Ultrasound में ना उतना clear नहीं है. Machine is not.
Sir, can we take some questions? There are
Yes,
some
yes,
questions.
yes.
Sir, how many times you have to inject this? What is your protocol, sir?
I normally do it, if it's a simple thickening, then I do it twice in a period of about 20 days.
So after 20 days, one more time.
Yeah, I repeat it.
And sir, what are the post-procedure instructions you give to your patient?
Post-procedure instructions are that cold fomentation has to be done, but it should not be extreme cold fomentation. And apart from cold fomentation, then those dynamic braces with dynamic calipers should be used so that the area doesn't sway. There is no extra load on the ACL while walking. Because you know, when ACL is weak, what happens is there is a lurch. The patient always says कि पैर लचकता है. तो अगर लचकेगा तो फिर ACL कभी भी रिपेयर नहीं होगा. So those dynamic braces at 50 degrees angle, what I mean to say is, जो dynamic brace रहता है उसमें upper leaf and lower leaf के बीच में जो आपकी watch रहती है उसमें आप 50 degrees angle set कर देते हो. So now patient can flex the knee to 50 degrees also, but while wearing it there will be no side to side movement, so the ACL is protected. This is very important, as important as the procedure.
So for how long this brace is put?
Patient wears the brace for 5-6 months till ACL is fully regenerated.
And how do we check for that? Do we do a post-procedure
When
scan?
you're, see, the other first clue is that you get is once, if you're not done the procedure properly, you get the repeat fusion also. Or if your patient is not following your instructions of wearing the braces throughout the day, except for during the sleep, then too you will get the effusion. So if you're not getting the effusion, patient is comfortable and doesn't point that the area of pain is below the patella. Normally ACL pain is below the inferior pole of the patella. If the patient says there is no pain there, then you are happy that your ACL is getting repaired.
Sir, do we do this for both traumatic and inflammatory causes, or only or degenerative causes?
We do it for traumatic also, we do it for inflammatory cause also. But if there is an inflammatory cause, and for example if it is a rheumatoid arthritis, causing significant level of effusion, then it is better to first treat it with DMRDs. Reduce the level of inflammation, because if the inflammation level is quite high, your PRP is not going to work.
And what about degenerative, sir?
Regenerative follows after the after the DMRD settles down the effusion part, the inflammation part.
No, sir, I'm asking about degenerative causes, like for example the ACL degeneration.
Sorry?
Degenerative causes.
Yeah, that we can do it in the first stage only.
Great, sir. Any other question? So this patient had had some trauma.
He never knew about it, but he had ACL problem along with the subchondral bone marrow lesion plus cartilage problem, minor cartilage fractures.
So the presenting symptoms were pointing towards ACL pathology, or it was
No, it's
just
what osteoarthritis, prolonged osteoarthritis with ACL problem.
Thank you very much, sir.
Welcome.
So one more question.
Yeah.